Hi guys, so Dr. Rahul here, and in this session I will discuss about emergency medicine or BLS guidelines etc. in the bit details because this has been asked, and it is important for all your exams. So we'll discuss it here in little brief session, correct? So let's begin, right? Yeah, fine. So I will discuss here first CPR. CPR is cardiopulmonary resuscitation, right? Cardiopulmonary resuscitation. Now CPR, what is the sequence? See sequence, okay. So CPR, what is the sequence? The sequence we will remember as CAB, circulation, airway, breathing. Circulation, airway, breathing, right? Okay. Now how much circulation? Okay, we will come to it at a later point. So as for now, we will remember circulation, airway, breathing. Chalo, next. Now Now I will discuss about management of arrhythmia management. Okay. So see, arrhythmia may be shockable or non-shockable. Means you patient can be recovered with DC shock or shock is not useful, right? So shockable includes ventricular fibrillation, pulseless pulseless ventricular tachy, or polymorphic ventricular tachy. These three not important, just for completion's sake. Non non-shockable includes asystole and pulseless electrical activity. Okay, so the question what it is asked is end point to stop CPR, means when we will stop CPR, right? So return of spontaneous circulation, okay, by carotid palpation. Every word is important, has been asked. So this is the point where we will stop CPR. When spontaneous circulation will return, how we will understand? By carotid palpation. Then we will stop CPR. Now, now remember that in CPR always search for the cause. Treatment adrenaline for 2 to 3 minutes and then you can repeat. Amiodarone is also there. If still there is no response, declare as dead. In details, I will be discussing now. Say the patient is, see, it will be followed in the next pages as well. So continue the table, right? See, shockable rhythm, you will definitely do CPR. First you will check the scene safety, right? Then you will call the helpline and then you will go for CPR. In case of children, you will first give CPR then call for helpline, but in case of adults, first call for helpline, scene safety, then check for CPR, right? Now CPR, then you will go and defibrillate defibrillate. Okay, I'm continuing the defibrillate part. Now defibrillate CPR for 2 minutes. You will give CPR for 2 minutes. Either the rhythm is shockable or the rhythm is organized. If rhythm is organized, means everything is sorted, pulse palpable, then here you will stop CPR. No CPR required more. But the rhythm is still shockable, then I will give injection adrenaline plus shock. Then again I will repeat CPR. I am continuing this one, right? Again I will give CPR for 2 minutes. Again if rhythm is shockable, again adrenaline shock, CPR 2 minutes. And if rhythm is shockable again, then same thing. After 2-3 repetitions, correct, we will give injection amiodarone. If still the rhythm is shockable, right, then we will give injection amiodarone. And if there is no response, after 20 minutes, we will declare dead. So we are giving adrenaline at least 2 to 3 times. We will repeat it. If still it is shockable, then amiodarone. If then it is non-shockable, then we will declare dead. So 3 cycles of adrenaline plus 2 cycles of amiodarone. Non-shockable, then declare as dead. Okay. Now important part is here. See, there are only 2 drugs. Remember, 2 drugs only: adrenaline, amiodarone. That's it. This has been asked. Okay. Now chest competence has been asked. that chest compression, what is the rate? Rate is 100 to 120 breaths per minute, correct? Compression is 2 inches in adults, 1.5 inches in children. And you will allow full chest recoil, very important, full chest recoil to be allowed. Okay. And as I discussed already, compression is to ventilation. Okay. In case of adults is always 3 to 2. How many number of rescuers doesn't matter, but in case of children, if there is one rescuer, correct, if there is one rescuer, then it comes 30 is to 2, compression is to ventilation. If there are two rescuers, then it will come 15 is to 2. Okay. So this has been asked, very important. Now in adults you will give CPR in the lower of sternum. In children, same, but with two thumbs or two fingers, correct? And another important thing is, in airway there is head tilt, jaw thrust with bag and mask ventilation, right? You can apply this, correct? And so there is triple maneuver: head tilt, chin lift, jaw thrust, mouth open. Okay. Chalo. So and there is one dictum like never stop compression, never stop compression. Okay. Now what will you do in case of unconscious adult? See, in case of unconscious adult, now I'll tell you one by one, and every point is important with uh, you know order. So first I will check scene safety, then I will assess responsiveness. How? By checking the pulse for less than 10 seconds. So first I am checking scene safety, second I am assessing the response, pulse less than 10 seconds. Then emergency response team will arrive. Emergency response team I will call. Okay. Third and fourth is I will assess breathing and circulation. Now if breathing and circulation is absent, then fifth I will call for help. And then number six, I will start CPR. CPR I will start, right? And same CAB, circulation, airway, breathing. And by the time emergency response team will arrive, so we will go for defibrillation, correct? But in case of unconscious child, as I already mentioned, thing is totally different, because in that case, first in case of child we will assess. After assessing breathing and circulation, we will assess it first, and then we will give 5 cycles CPR, and then I will call emergency response team. In case of adults, first we will, after assessing only we'll call emergency response team. But in child, after assessing we will give 5 cycles CPR, then we will go for emergency response team. This is the difference, and you must remember it because this has been asked. Now what is the difference between BLS versus ACLS guidelines? See, BLS is for everyone, means everyone, layman, everyone, anyone can give it. There is no iv drug, simple. There is nothing in it, only AED, automatic defibrillator is there, and nothing is there, correct? But ACLS requires trained personnel. Here IV drugs is there, here manual defibrillator is there, right? Here intraosseous drug, endotracheal drug is there, here adrenaline is there, amiodarone is there. Both the drugs are in ACLS guidelines, correct? What is not in BLS? They're the basic things, right? So where will you check the pulse? Mainly in adults, carotid; in children, brachial, right? And also it's important that post revival, what will you do to the patient? We will not just leave the patient, right? Post revival, we have to check pulse and BP. But most important, we have to check for therapeutic hypothermia, because post shock revival patient may go for hypothermia 32 to 36 degrees Celsius. So we have to check for that. And mean arterial pressure should be 65 millimeter mercury, and we should never give, or we should try to avoid dextrose, right? And we will check for therapeutic hypothermia because patients are likely to go for it, right? And also asked most common rib fracture in CPR. See, it is mainly third to fifth ribs. most important, has been asked. And now I will talk about the reversible cause of cardiac arrest has been asked. So remember, it is 5H and 5T. 5H, in case of 5H, hypovolemia, hypoxia, acidosis, ठीक है, hypothermia, hypokalemia और hyperkalemia. So hypovolemia, hypoxia, acidosis, hypokalemia, hyperkalemia, and hypothermia, correct. And 5T, tension pneumothorax, tamponade, cardiac tamponade, toxins, thrombosis, pulmonary and cardiac, correct. Tension pneumothorax, cardiac tamponade, toxins, thrombosis, pulmonary and cardiac. So with this, I think I have discussed major points about CPR in your emergency medicine, and I hope this session will be helpful. I have discussed. I have actually, this is a continuation of the your anesthesia section, so I hope this will be beneficial for you to understand a bit deeper. And whatever lines I have mentioned, whatever points I have mentioned has been asked, right? So don't miss these points and stay tuned for my next uploads, right? So next, I think I will be taking your dharma will take dharma or pits, right? Stay tuned, right? Okay, thank you and good night.